Dr. Ely Walker has been a mainstay in Del Norte's Rio Grande Hospital and surrounding San Luis Valley for over 10 years. He is an avid teacher, precepting students any chance he gets. Jayden Frazier is a second-year medical student hailing from Alaska, on a rotation in Del Norte learning from Dr. Walker in the recovery clinic. He hopes to return to rural medical practice after his training is complete. This is the story of precepting students in rural Colorado, why it's important, and how to get involved.
I love teaching. I always have. It's been a really fun part of being a doctor, is getting to share what I know and trying to empower the next generation to do it well.
I have a lot more space to learn down here that I really enjoy. That was definitely one of the big pros of coming down and doing this program, is I'm the only learner, so I get so much face time with all of my preceptors. It's just the two of us working together.
You know, in this particular environment, actually Jayden is to the point where he actually is a multiplier for me. I can actually get more done and see more because he's been trained so well. He does a good job. And so I don't have to spend 20 to 30 minutes with patients because he's in there doing that right now, which frees me up to do other things as well. It's a win-win, and you know, I think patients love interacting with him, and he's good at it. Yeah.
What do students bring to your practice?
Energy, and I think kind of a newness and novelty, because you know, I've been in attending for 10 years now, and see a lot of the same things over and over, and it becomes very algorithmic in many ways. And so for them, it's like the first time they're doing this. And so that energy and excitement, I think the patients feel it in a good way. And then also the other staff, the nurses and the care coordinators and those folks also kind of get to feed off of that energy and excitement. So
Precepting medical students early in their journeys shapes the next generation of providers and exposes them to the challenges and opportunities of practicing in rural settings.
I think that you can't really imagine what it's like to practice medicine with limited resources until you actually do it, because when you're in training in the city, you have everything at your hands, not just the attending physicians, but fellows and residents and testing resources. And so until you get put in the situation where you have to do it without, it's hard to even wrap your brain around.
Yeah, I mean, Colorado with a large area of rural and frontier communities, I think we need to invest in our future and our future providers. There's already workforce shortage throughout the state. And I think these interactions that these students are getting here are high quality, creating really good providers, but it's also incentivizing them and demonstrating to them that this is a viable pathway and they could be happy here and really have a good, satisfying career.
It absolutely is a retention tool, and that was probably the reason that we initially started making it part of our strategy plan, is because it was hard to get doctors, providers at all to this area because it's so remote and it's rural. And so we felt like that was our best opportunity to show people, hey, we do a great job out here. We would love to have you join us. And so a lot of times they will come back. I mean, we've had several through the programs that have come back and worked for us. So it absolutely is a retention tool.
I came here as a third-year medical student because my brother lived in Del Norte. And so I came here for a month and worked at this hospital. It would have been about 2008. And then, you know, when it was time to look for jobs, had fond memories of working in this place and remembered how enjoyable it was. And so, yeah, it was high on the list for sure.
In 2016, Colorado lawmakers passed a tax credit that preceptors could claim for teaching students in rural and frontier areas. The credit allows preceptors in a number of primary care specialties to claim up to $6,000 in tax credits annually, and serves as a vital incentive for preceptors to take on the extra work of teaching a student while increasing the rural primary care workforce.
I think it sure feels nice to be recognized at the end of the year and kind of like, wow, somebody really sees the value of what I'm doing and the time that I'm spending to make this happen. And so to have that credit come back from the state, just, you know, it makes me want to do it again. It just makes it more of an enjoyable experience, and I think, incentivizes me to keep doing what I'm doing.
Yeah, so I think that in general, rural medicine feels forgotten about. Like, a lot of the resources go to the cities. Even when you're talking about resources for impoverished populations, which many rural populations are, some of the most impoverished in the state, still those resources go to the impoverished populations in the city. So I think, doing something like the rural tax credit tells the rural areas that actually you do matter and you are important to the state, and we haven't forgotten you.
It's hard work out here. It's tough to come to these areas. It's not easy. So if we have any incentive at all to get them out here and help them at least consider rural health care, it's going to be helpful for our state as a whole, because I think we need to invest in rural health care because it's tough financially right now anyway. And so we just need that help.
To learn more about the Preceptor tax credit and how to claim yours, reach out to CRHC or scan the QR code on your screen.